Hi, this is Ronico. This lecture, I will talk about non-pharmacological management of pain. The learning objectives of this lecture is we will discuss the advantages of using non-pharmacological pain management therapies and also be familiar with how to use those therapies as part of the multimodal approach to manage pain. And I'm going to use arthritis as example because this is one of the clinical conditions that we see the most in our general practice and utilize different kind of multimodal approach to manage arthritis. So whenever a patient has a joint pain, we know that pain is not only the clinical sign the patient going to be experiencing. Over time, they're also going to affect other joint motions, muscle mass, and eventually will become a chronic pain or sensitization. So this is how it works. So when the patient have a joint pain, they will decrease exercise. We know that exercises is very important to maintain joint function and muscle mass. So now that the dog is not walking much, then they would develop muscle atrophy. And it will increase stress on the joint capsules, ligaments, and cartilage, mainly because muscle play a role to absorb stress. So now that the muscle no longer absorb stress when the dog's walking, running, or jumping, and then the joint capsules or ligaments, they're gonna absorb more stress that distributed to the body. Over time, it will cause damage to the cartilage. It will cause inflammations, and if the inflammation keep going on for a period of time, it will decrease the nociceptive threshold and cause hyperalgesia. This is where the chronic pain comes in. Eventually, if it is not being treated appropriately, it would become a central or peripheral sensitization. So the nerve firing is the main issues when it comes to chronic pain, no longer joint pain or joint inflammation itself. So when we want to treat patients with arthritic pain, we not only need to use anti-inflammatory, we also need to use other medications or modality that help to suppress or minimize the sensitizations within the nervous system. So here's the list of some of the multimodal pain management that within my pocket. Every time if I have a patient with chronic pain, I will look into those lists to see if I've been doing selecting the right or appropriate combination of treatment for my patients. First of all, pharmacological agent definitely something that I would consider. That will be the cornerstones of pain management, right? We talk about NSAID, Galliprant, Amantadine, Gabapentin. Those are the pain medication that would really helpful. We also would consider nutraceuticals, which we talk about in one of the lecture, where we were combining glucosamine, granite muscles, fish oil, and CBD. Those are the nutraceuticals that have found to be beneficial when it comes to treating arthritis. Weight loss definitely is very important, which we'll discuss that in the next slide. Acupuncture, laser, pulse electromagnetic field therapy, TENS, therapeutic ultrasound, and shockwave, they have been shown to have some benefit when it comes to treating arthritis or chronic pain. Exercises and manual therapy, it's one of the major part of physical therapy or physical rehabilitation. And you're going to learn more of those techniques in the CCRV lab. Manipulation or chiropractic is another area that could utilize to help for pain control and also improve joint functions. When it comes to treating osteoarthritis or chronic pain, if I know that the patient is a little bit overweight, and definitely that I would want them to lose weight. Even for patients that have a normal body condition score, which is 6 out of 9, sometimes I do recommend that owner may keep them a little bit thinner side, which is 4 to 5 out of 9. Usually it's 5 out of 9 that would be ideal to me. And we know that weight loss can significantly reduce pain from arthritis and also other orthopedic conditions too, and even neurological conditions. If the patient have chronic IVDD, then definitely they would benefit having lost some body weight. When it comes to weight loss, nutritional screenings, evaluation is very, very important for every pet, because we want to make sure that they also getting the nutrients that they need when you cut down the diet. And also need to rule out other medical diseases. For example, dogs that are overweight, especially older dogs, they may have hypothyroidism, Cushing disease. Those are the diseases that we need to rule out, so that we know that how to help them to get to the optimal body condition score. So here just my take how I usually recommend owner to control the body weight. First of all, I need to rule out underlying diseases. And to me, the most successful way to lose weight is exercises, which is a rehab or underwater treadmill, plus diet, and plus some supplements, such as L-carnitine have found that it will help the fat tissues to metabolize quicker in the body. So it may benefit patients for losing weight. And I always will calculate the energy requirements for the patients and make sure that they're getting the right amount in order to help them to lose weight. I will calculate the RER based on these equations, and then the MAR I usually use 1.0. Some vet use 0.8, but to me, I will start with 1.1, so that I don't cut down the amount of diet too much that the dog, a lot of time the owner will complain about the dog starving to death. And again, for treats, we know that we need to limit down to less than 10% of the total calorie intake per day. Ideally, I would recommend owner that if they could switch to prescription diet, that would be great, because prescription diet contains, they reduce the amount of food, but also make sure that the dog gets all the nutrients. The company that I commonly use is Hughes Metabolic, with or without mobility, or Purina OM, or even for canine, Royal Canin, they have satiety for weight loss. If you also can have the owner continue the normal diet, just cut down 30% of the current amount diet if you're not able to measure the exact calorie per day. The only problem about cutting down the amount of diet is that sometimes the dog might not get the enough nutrients from the diet that you just cut down. So this is why I always recommend ideally switching to prescription diet, so that the dog can lose weight healthily without any lack of nutrients. You can also consider switching to canned food, because canned food contain more water that would fill up the stomach quicker. And ideally, we want the dog to lose weight about 4% of the body weight per month, which is again 1% per week. You should. It really depends on the owner what they prefer to do. Some owner doesn't like to weigh the dog every week. They like to weigh the dog every month, and there's a benefit of that within a month, because you're gonna see more of significant weight loss if you weigh the dog after 4 weeks, rather than if you weigh the dog weekly, you're probably not going to see much improvement. And sometimes that owner lost patience because of that. So sometimes I just tell the owner to weigh them every month, so that we can see a little bit significant loss of number. Now, next I'm going to talk about modality that I commonly use for my patient when it comes to arthritis. So you can use cold therapy, especially that patient that have acute flare-up of arthritis. So we know that arthritis is a chronic condition, so they usually benefit from heat therapy. But sometimes when the dog went out, run and jump, they may have acute flare-up of arthritis. That would be the time I would tell the owner to do a cold therapy for maybe like 1 or 2 days, and then switch back to heat therapy. So the benefit for cold therapy is increased pain threshold, vasoconstriction, reduce inflammation, and decrease muscle spasm. Application wise, you can use ice pack, or you can just froze, or using the ice to do ice massage. And I would do it 5 to 10 minutes, or you can do it after activities or exercises. For heat therapy, the benefit from doing it is reducing muscle spasm, increasing local circulations, relax muscles, and also improve muscle or tissues elasticity. So we benefit before doing stretching because it would help to loosen up the tissue so that you can get a better flexibility of the tissues. You can apply 15 to 30 minutes. You can do it before exercises, just help to warm up the body. In clinic, if you want to do a deep heat therapy or deep tissue heat therapy, then you looking into utilizing therapeutic ultrasounds, because usually heat packing, the heat only penetrate down to like 1 or 2 centimeters down the superficial skin. If you want something that penetrate deeper, then you definitely have to use therapeutic ultrasound. Acupuncture. I'm sure everybody here, most of you are probably familiar with acupuncture already because you're probably already practicing it. So again, acupuncture from the Chinese medicine perspective, it increased blood flow, but from the Western perspective, it's stimulating the nerve endings, sending impulses to the spinal cord and the brain that releases beta endorphins, that very helpful for pain control. It also helps to regenerate nerve, which would benefit patient with spinal cord injury or any kind of nerve injury. Acupuncture also have immunoregulatory effect where it will regulate the immune system. For example, if the patient has a lot of inflammation, acupuncture has found that it will suppress the immune or inflammatory cells to reduce inflammation. If the patient has lack of immunity, let's say that after chemotherapy, the patient have a low white blood cells or platelets, and acupuncture has found that it would help to boost up the immune cells. Laser therapy utilizing wavelength specific form of photobiomodulations. In general, the wavelength that benefit for the body is more than 600 nanometers. Most likely is between 808 up to 980. Some company they use wavelength more than 1,000. But anyhow, those are the wavelength that we call infrared wavelength that can penetrate to the body, deep to the tissues, and cause a series of modulations, which include increased blood flow, increased oxygen release, increased ATP productions. This is just part of the laser therapy mechanism. There's a lot of mechanism out there you also need to look into as well. So those three benefits for pain relief and also increased cell growth, replication, and repairs, increase fibroblasts and lymphocytes, stimulate cartilage growth, and that's why we use that for osteoarthritis. In general, I do recommend 6 to 8 sessions when the owner decided to do laser. A lot of time that one laser may not see the most benefit, so they have to do it more frequency. A different company recommend a different frequency. So for me, I'm using companions, and I do recommend laser therapy at least once a week, ideally 2 times a week or even 3 times a week, and finish up 6 to 8 sessions, and then reevaluate the patient to see if I get any benefit. If not, then I either will consider another rounds of treatments that I would increase the dosing, or I would tell the owner that maybe laser is not an option. Then we can look into other modalities. So it's really up to you, again, how you want to formulate your treatment plan for the patients. Post-electromagnetic field therapy have found it would help to reduce nitric oxide. I think this is a mistake. It helped to increase, if you can correct that for me, it helped to increase nitric oxide signaling pathway that regulates inflammation and healing. So PEMF, basically, it will increase the nitric oxide. We know that nitric oxide is a very important factor or mediators that help to regulate inflammations. It would help to improve the wound healing, but if the patient have any kind of inflammation and pain, it actually helps to reduce the inflammations. It also increases oxygenation and nutrients that would help to improve cell and tissue metabolisms that would speed up the tissue healing. So in general, the indication of PEMF is for inflammation, swelling, pain, wound healing, arthritis, and also post-surgical healing. In human, PEM actually have been shown in quite a few of randomized control trial that it would benefit patients with knee arthritis. Unfortunately, we don't have a lot of data or evidence using PEM in dog with osteoarthritis. We do have some evidence using it post-hemilaminectomy that have improved wound healing, reduced use of pain medications, and improved proprioception. At least I'm still waiting for any result, like study using PEM for osteoarthritis. And in general, I use that for 3 to 4 times a day for 2 weeks. And this is actually based on the product that I use, which is the Assisi Loop from Animal Health. So Assisi Loop, according to the company, you can use 3 to 4 times a day for 2 weeks, or until you see some results. Then you can reduce the use of frequency to 1 to 2 times daily or weekly. There's a different lecture that we're focusing on PEMF. If you're not so sure about how it works and how to use it, then I would recommend that you refer back to the lecture I gave regarding PEMF. TENS, or transcutaneous electroneurostimulations. I hope that you're already very familiar with what it is and how to use it. So TENS affect the nerves that release endorphin, good for pain relief. For acute pain, we use a higher frequency. For chronic pain, we use a lower frequency. I hope that by now you know how it feels like, why that we use high frequency for acute pain, why we use low frequency for chronic pain, mostly based on how you feel it when you use that, select that frequency for that conditions. For muscle strengthening, we can use 30 to 50 hertz, and that's mainly aiming for neuromuscular electrostimulations, which is eStim or MS for muscle atrophy. So here we're talking about pain, that we talk about TENS unit. You use it for 15 to 20 minutes once a day or as needed. As we mentioned in the lecture that TENS is more for symptomatic management. So if the patient doesn't have pain, you use TENS unit, you're probably not going to see any benefit. We only use that when the patient is painful. Therapeutic ultrasounds utilizing high frequency sound wave passing through the skin, causing mechanical vibration and heat. So again, it's very, very useful if the patient has a very, very tight and stiff joint capsules that you have trouble extending or flexing the joints. So by using the therapy ultrasound, it warm up that joint capsules or even the soft tissues, and then you can get a better extensibility of the tissues. So that's probably one of the main things that I use for when it comes to treating arthritis. The heat therapy also providing some pain relief as well. So some dogs really like that heat therapy from the ultrasounds. That's something that you can try. If the dog likes it, then you can do it every time the patient comes to see you. If they don't like it, then I would just select a different modality to do it. Again, here are just some of the actions of ultrasound: increase circulation, thermotherapy, relieve muscle spasms, especially when the patient have a huge trigger point or the whole big chunk of muscle is spastic, that it doesn't like you to touch it, doesn't like massaging, then you can actually consider ultrasound and just kind of using that like a micro vibration to relax that muscle spasm. Like I say, increase tissue extensibility that would help to improve range of motion. It also breaks up adhesion and fibrosis, especially for the area that the chronic pain may because of the scar tissues or fibrosis. For example, FHO is a typical case list that I treat. when there's a lot of fibrosis there that restrict the range of motion, and those fibrosis actually can cause chronic pain. So, and then you can use the therapy ultrasound to break that scar tissues, not only able to relieve the pain, but also can get a better range of motion in patients with FHO. 1 megahertz versus 3.3 megahertz. Hopefully you don't know what that means. Basically, it determines the deep penetration of the sound wave. You can use that once a day, or again, 1 to 2 times a week, or anytime the patient coming in to see you for physical therapy. Shockwave, it's therapy that produces high energy wave that penetrate to deep focal tissues. Depending on what the gel pad you're using or you're selecting, it could penetrate up to 10 centimeters. Okay. What it does is it converts the chronic condition and change it back to the acute phase, and resulting in a modulation of inflammatory cytokines, which is good for pain relief, especially for chronic arthritis. It also improves angiogenesis, which would benefit for wound healing, especially tendon or ligament injury. We know that these two type of tissue, they don't have direct blood supply. So this is why that when they heal, it usually take quite a bit for them to heal compared to like bone or muscles. So using shockwave have found that it would help to speed up the wound healing of those tissues, which is tendon and ligament. Shockwave also have found to increase osteogenic proteins, which help to improve bone healing, especially for non-urine fractures. But again, I do use that for pain control, especially coming from osteoarthritis. Once the effect kicks in, sometimes that the pain relief can last for pretty long, 6 to 12 months. In general, it requires 1 to 3 treatments. I would start 1 treatment to see how the dog doing, and then you can always like do another treatment within a week or within 2 weeks. Different machines, they may have a different results. Versatron, which is a hydraulic shockwave that requires sedations, it gives out a stronger energy density intensity, so you may see better results. As compared to piezo wave, usually doesn't require sedations, but the EDF usually would not go as high as like the Versatron. But when you're using the piezo wave, you might looking into like doing once a week for 3 or 4 times in order to see any benefits. As opposed to Versatron, probably after 1 treatment, the patient would see some significant benefit already. Now, talking about non-pharmacological management, rehab definitely play a very, very important role, and that's why you're here to learn about rehab and get certified in rehab. So rehab using a non-invasive technique modality to reduce pain and restore functions. The goal is to relieve pain, minimize tissue changes, return to normal activities. When it comes to rehab, it's just like human physiotherapy. We're more focusing on using manual therapy. Remember that we learned massage, joint mobilizations, and also soft tissue mobilizations, and also therapeutic exercise as well. So those are the important things that would benefit patients when it comes to chronic pain control that affected their functions. So again, manual techniques decrease pain, increase circulations, reduce swollen, increase soft tissue extensibility, and normalize joint mobility. We'll do range of motion stretching, joint mobilizations, massage, and trigger point pressure or myofascial release. So range of motions, there's a 2 ways that we can do it. The reason why we do range of motion is to improve cartilage nutrition, maintain joint function, and decrease pain. The 2 ways that we do range of motion either by active range of motion exercises or passive range of motion exercises. Passive range of motion is the one that you do all the motions yourself. The patient is not doing anything. But what we prefer is active range of motions, because eventually we want the dog is the one that able to move the joint, improve the range of motions by themselves. And how do you do that? You can do swimming, underwater treadmill, because like this, swimming is very good for front limb, especially for the elbow range of motion and also couple joint range of motion, because this is how the dog would like try to float themselves and paddle. Same thing the hind limb as well. So you're gonna benefit like hip flexions, extension, and also stifle flexion extension too. You can also consider cavallari, stairs, and ramp. So that's the one that when they pick up the limb, that's gonna have to flex and through the range of motions. Sit to stand is very good for range of motion and hind limb because the dog have to flex the hip joint, stifle, and tarsal joint when they are sitting. Same thing, if you want to train for the front limb, you can do lie down to stand up. All right, stretching. Again, so it go beyond the normal or pathological range of motions that help to improve flexibility of the joint capsules and tissue. So we need to flex or stretch it and hold it for 10 to 15 seconds. So we usually don't do more than 30 seconds, if you remember, because any stretching longer than 30 seconds, it actually loosen up the soft tissue too much. It actually may result in some instability. Okay, keep in mind on that. So every time we do stretching, we do 10 repetitions, 2 times up to 3 times a day. So massages, we always overlook massages for pain control. Massage is very powerful. So I'm sure nobody here doesn't like massage, right? So massage always relax your muscles, relieve your trigger points, myofascia, and then calming your bodies down. Same thing the dog as well. You can see how calm this dog's when she's getting massage from one of my colleagues. So the dog have a back pain, so have a very stiff muscles, very sensitive to acupuncture needles. So instead of putting needles in directly, we're gonna do some massaging first. You can see how much he likes it. So massaging, reducing muscle spasms, reducing swollen, pain relief, and relaxations. It also improves attitude as well, especially dogs that are nervous, anxious, depressed, especially that patient sometimes coming from the ICU, they're very depressed. I would do massaging first before I even do any other modality. Alpharage, the twin-arm massage, Mofa, Rofa, Ichisa, Nifa can be utilized. Okay, so in the lab, you already learned a couple of techniques that actually can utilize on your patient or even teach your technician or owner to do at home. I always start with the areas that are not painful. Again, if you touch the areas painful, that dog probably not gonna like it because they think that the massaging that causing the pain, so they would relate it to that. Joint mobilizations, it's one of the important technique that you need to know for sure when it comes to physical therapy. Okay, we have grade 1, 2, 3, 4. Again, 1, 2, it's for pain control, and then 3, 4, it's improving range of motions and also overcome restrictions of the joint capsules. And of course, chiropractic, some people refer that as the grade 5 joint mobilizations. That we don't learn it in the rehab because if you want to perform chiropractic or manipulations, you have to go through a different course so that you can learn more and how to use the technique. So chiropractic is a system of medical care founded by Dr. Daniel David Palmer in the 80s. The way that this chiropractic view the body is pain and diseases can be caused by vertebral subluxation complex, meaning that the vertebra is out of alignment. So when it is out of alignment, it can affect the sensory input and motor input along the nervous system. Over time, it's gonna cause pain, and also because it is out of alignment, or we call subluxation, it's gonna reduce the movement of the joint as well, especially the vertebra. So what chiropractors do is they will put their hands on it and then look for any subluxations or malalignment. Then they will apply a high velocity and low amplitude thrust, also known as dynamic thrust. So by doing so, you're going to quickly and hopefully that it will put that subluxated vertebra or malaligned vertebra back to normal positions. Then you're able to fix that sensory input and motor input, and that would help to control the pain, and also that would also help to improve the range of motion of the joint too. So before you perform chiropractic, again, you have to go through the course and then be certified before you do it. And again, before you treat the patient, it is also very critical that you have a complete and accurate diagnosis. Because if you don't have a complete or accurate diagnosis, sometimes you can cause more damage than it already has. Let's say fracture. You don't want to do chiropractic on patient with fracture or even micro fractures. Frequency-wise, we do weekly or monthly chiropractic. Depends on how soon or you could adjust the malalignment, or how soon that malalignment recover. Sometimes they may need weekly for 3 to 5 weeks. Once it's better, then you can go to monthly just for maintenance. Okay. A few contraindications of using chiropractic include if it is severe DJD, you have to be very careful when you're doing chiropractic. If there's acute inflamed IBD or even joint disease, you have to be very careful because by doing so, you might make the inflammation worse. In general, the way that I treat actively inflamed joints or back issues, I would start with laser, massage, acupuncture. Then if they get better, then I might consider adding chiropractic. Or you can start with joint 1, grade 1 joint mode, and grade 2, which is good for pain. So when the pains get better, then you can go to joint mode 3, joint mode 4. If the doctor is okay, then you can consider chiropractic, which is some people consider as a grade 5 joint mode. If there's a tumor disease in or near the spines, again, you don't want to aggravate it. Area that is infected or there's open wounds, definitely no chiropractic. Or if there's a significant or generalized maladaptive pain that you don't know where is the source of the pain, sometimes that we'll be very careful, or we need to figure out what's exactly the cause of the pain first before we do any chiropractic. Patient have osteoporosis, osteopenia. Again, you don't want to do chiropractic just because you may increase the risk of fractures. So next, let's talk about therapeutic exercises. I'm not going to go into detail because you already learned that in session 2. I'm just going to go over the other part of the non-pharmacological management is utilizing exercises. So when we come to exercises, we're targeting weight bearing, proprioceptions, balancing, strength, and core. Okay? And then exercising those for pain is not the same as exercising for fitness. So you want to go very, very slow with your exercises. As the patient get better, then you can increase that exercises intensity, frequency, and durations. Exercises should not be painful. So if the dog is painful when doing exercises, that means that exercises may not be ideal at this stage. You have to either prevent it or adjust it. I usually choose 2 to 4 exercises per sessions, 2 or 3 times a day and up to 4 times a day. Depends on how painful the patient and what are the functions abnormalities of the patient. Again, rate of progression is based on patient response, and always make it as a game rather than therapy. So the way that you do it, always praise the dogs, provide treats, and that's, I always joke about that. Dogs are smart, but they can be dumb as well, because things that they do sometimes related to what kind of reward they get. If they do one exercises, they get rewards, and they will keep doing it even though without you asking them, right? So sometimes they're very, very, very joyful to work with. So the couple things that before exercises, I always mention about you have to be prepared for exercises, not just do exercises right away without considering the environment, considering the patient conditions. So one thing is definitely you need to make sure it's a good traction of floor. It's also a cushion of floor, carpet, grass, gym mat, yoga mat are the best. If the dog having trouble walking, always give some support. Help them up harness the one that I always use. If the hair is so long, make sure you trim it. And of course, this is my pet peeve, right? So long toenail, again, always picture that dogs walking a long toenail is just like you walking in a high heel. So it's not ideal. It could cause more damage when you do exercises. So make sure that you trim the toenail, make sure they are short enough. Hydrotherapy, especially underwater treadmill, it's one of the main therapeutic exercises that we commonly use for patients with osteoarthritis or like functional abnormalities due to chronic pain. Underwater treadmill have at least 4 types of advantages. Buoyancy, which help to reduce impact of the joints, that help patient able to stand and walk longer in the water. The resistance of the water help to build up the muscle strength, and the thermal effect of the water increase circulations of the soft tissue and joints, which would help to reduce swollen edema. It also helps to improve nerve conductions, which would benefit patients with neurological conditions. Hydrostatic pressure of the water, it helps to reduce the edema and swelling of the joint and soft tissues. Another area of non-pharmacological management for pain is the assistive device, which we'll talk about that in session 4. Using different kind of orthotic braces and wraps that help to stabilize the joints. And then by stabilizing the joints, actually when the dog walk, they're less likely going to become laxity, and the laxity may trigger the inflammation and pain. So by stabilizing it, it can actually also help for controlling the pain too. Again, we will talk about that more when it comes to assistive device lecture in session 4. So as summary, dealing with pain, we know that multimodal approach is the key. Drug alone doesn't really work well, especially when it comes to chronic pain or when it comes to treating osteoarthritis. So today we learned a couple non-pharmacological modality that you can choose one to see how it works, or you could also like combine 2 or 3 and then so that you can get better results. To me, when I'm treating chronic pain from arthritis, I usually would start with definitely acupuncture, because there's a lot of evidence in human side how acupuncture could help for pain control, and I may add laser. So those are the 2 things that I may start with, and I will send home a CC loop so that owner can use it at home. Okay. Of course, exercises, rehab, I would definitely add them to my treatment plan as well. If the patient doesn't feel like getting better after like a month or 2 with the modality, then I would consider shockwave, because again, sometimes that's shockwave, like we say, shockwave converted chronic condition back to acute inflammation. That would help to speed up the healing. So sometimes body needs to convert that chronic condition to acute so that it would relieve the pain. Instead of using acupuncture, laser to suppress the pain or inflammation as much as possible, sometimes we just have to go the other way. And then if that works, then I would tell the owner maybe we can continue with the shockwave wave once a month or every couple weeks for long-term management. Okay. So again, multimodality management works effectively because they are safe and effective. They cause less side effects. They enable lower dose of drugs. Again, you're gonna see the patient more frequently for monitoring and follow-up, because they're gonna come to see you for treatments. And owner gonna feel more proactive as well, especially if you prescribed exercises for them to do at home. They feel like that they are involved in the treatment of their pets along with you. A lot of clients, they love it. And again, this lecture only talk about part of the common non-pharmacological therapies. I'm sure there's going to be a lot of new technology out there that coming out every year. So make sure that you look out for those new technology to see if there would be something that would benefit our pets that we could apply on them in the future. Thank you. So this is the end of the lecture. Thank you, and I hope you have a good day. Bye-bye.